Philippines is one of the hazard-prone countries in the region, if not in the entire world. No? Because of our geographic location, we are visited by an average of 20 typhoons every year. In addition to that, because of we are in the western side of the Pacific Ring of Fire, we have plenty of active volcanoes, earthquake generators that could trigger tsunamis and landslides and so on.
There are also emerging risks on a regional and global scale, such as the H1N1 influenza virus and the impact of climate change. Continuing armed conflicts disrupt and damage communities and strain the capacity and resources of government institutions. There is now a greater need for durable approaches to reduce the risks of communities to various types of disasters. In 1998, the National Disaster Coordinating Council created the Gawad Kalasag in order to recognize and encourage the efforts of local governments in building the resilience of communities in the face of disasters. With the Gawad Kalasag, the National Disaster Coordinating Council hopes to institutionalize excellence in disaster risk management and humanitarian assistance. Gawad Kalasag was conceived to encourage various stakeholders in designing and implementing disaster risk management programs for high-risk communities.
The role of the local government units are very important. So we thought that of all the sacrifices, the assistance of local governments being the frontline institutions, we thought of giving them incentives. The NDCC thought of creating these Kalasag Awards to award local disaster coordinating councils, those who are exemplary in terms of preparedness, mitigation, response, and rehabilitation.
To date, the National Disaster Coordinating Council has awarded the Gawad Kalasag to 49 local disaster coordinating councils, 18 non-governmental organizations, 50 institutions, and 15 individuals in the national level. Beginning 2001, it has become a practice to elevate winners for 3 consecutive years to a Hall of Fame.
The Hall of Famers actually, they are evaluated based on the 4 areas like mitigation, prevention, response, rehabilitation. They are evaluated based on those broad criteria. We are now biased towards capacitating them on mitigation and prevention, because we believe that local governments and other responders should be more proactive.
In 2005, members of the international community gathered in the Hyogo Prefecture in Japan to establish a unified framework for action for risk reduction. 5 priority areas were identified. Ensure that disaster risk reduction is a national and a local priority, with a strong institutional basis for implementation. Identify, assess, and monitor disaster risks and enhance early warning. Use knowledge, innovation, and education to build a culture of safety and resilience at all levels. Reduce the underlying risk factors. Strengthen disaster preparedness for effective response at all levels.
It complements the HFA, further strengthens or reinforces what we are supposed to be doing.
This year, Gawad Kalasag aims to showcase what is being done to respond to the HFA priorities and how good practices are increasing people's capacities and reducing their risks. Community and volunteers' participation, as well as gender perspectives, are common key components that cut across all of the 5 priority areas for actions.
Different people will experience disasters differently. Poor women, children, indigenous peoples, and other groups who are made vulnerable by their status in society will have different needs compared to other groups who are more privileged. We have also seen over many years how community women play major leadership roles in risk reduction as well as disaster management. And this is why the Hyogo Framework for Action emphasizes the need for a gender perspective in all of the 5 priority areas.
The Gawad Kalasag recently included award categories for community-based disaster risk management.
For Oxfam, engaging with the government's awards-giving scheme is a way to also engage with the official perspective and support programs for risk reduction and disaster management. We are conscious that there is still perhaps quite a gap between existing practice and the priority areas for action, but we are also aware that local governments do respond to Gawad Kalasag, and by promoting the HFA in the Gawad Kalasag, we anticipate that the priority areas for action will be the new targets for improved practice.
Even the health and education sectors have found themselves drawn along efforts to strengthen emergency preparedness. Those who are most at risk have a central role to play in reducing their vulnerabilities to disasters. Recognizing the contributions of individuals along with local governments, civil society organizations, media, international bodies, and the private sector have translated HFA priorities into tangible results.
There was a time when ordinary citizens were seen as nothing more than passive recipients of government instructions to evacuate. And Oxfam has been working for years to reverse this kind of attitude. We see community people as the primary actors in their own protection against disasters. But they will only be able to do that if, number one, they are given the official recognition as the primary actors, and number two, if they are given the information, knowledge, and other resources that they require to fulfill their right to their own protection.
Building on the success of best practices in disaster risk management will encourage an even wider array of social sectors programs, thereby strengthening the protective system that communities wield against hazard risks.
Both it's an honor and a responsibility. It's an honor because you are recognized by no less than the President of this country as best performer. But on the other hand, there is your responsibility. You have to maintain that status and probably improve even further your capacity. And also it's a responsibility because right now we are advocating local governments to share their experiences.
Certainly, there are many challenges to hurdle in the future. One is how to sustain the enthusiasm of many of our responders. The second challenge is that to widen the award scheme in the sense that we want to encourage more local disaster councils to participate, volunteer organizations, disaster response organizations to participate and vie for the awards.
As Gawad Kalasag celebrates a decade of best practices, the recognition it accords to exemplary individuals and groups continues to provide the encouragement and inspiration to everyone who stand in the front lines of disaster risk reduction.